Hi there. I'm going to give you a quick demonstration of the equipment you need and some exercises I do to try and remedy long-standing problem with golfer's elbow. You've probably checked some other websites on tennis elbow or golfer's elbow already, but just to reiterate, these are similar problems involving tendons around the elbow which are classified in medical terms as a tendinopathy. As a medical pathologist, I see biopsies of damaged tendons, particularly from the foot, such as the Achilles or peroneus tendons, and under the microscope we see evidence of long-term damage which produces microscopic tears of the tendon associated with swelling and new proliferated small blood vessels in the damaged tendon, which is an effort to try and repair the damage. But we don't see inflammatory cells like you see in appendicitis or a tonsillitis or an abscess. So the treatment of tendinopathy is different to treating other types of inflammation and requires two main components: stretching and strengthening. You can choose to see a physiotherapist or chiropractor for different types of stretching and strengthening programs. Some patients also respond to acupuncture. In my case, I've tried all of these for the chronic problem that I have, which is a combination of golfer's elbow and surfer's elbow. Typically, golfer's elbow occurs on the inside of the elbow and is called medial epicondylitis, whereas tennis elbow occurs on the lateral side and is known as lateral epicondylitis. Although these are the terms that we use, golfer's elbow can be produced by other repetitive strain injuries such as pitching or throwing a ball, rock climbing in the gym, chin-ups, repeated chin-ups. So there are a variety of things that can produce these same medial and lateral epicondylitis problems. As I said, which just represents a tendinopathy. I had great success for 6 weeks following a cortisone injection and was completely pain-free. But because my problem has been there for over 8 months, it requires a more intensive regime of stretching and strengthening. And I'll give you a look at some of the equipment that I have been using, as well as the advice I've got from my medical colleagues, what it's going to require to completely eradicate the problem I have. So to start off with, let's have a look at some of the equipment. First of all, the TheraBand, which you use in the same motion that one would use to wring out a towel. The second thing I have here is a muscle massage stick. Here I have what is called a hand trainer, which to exercise the fingers, to stretch them out and to do exercises such as this. I also have an example of the band that I use. Another example of exercise that is recommended is squeezing a tennis ball. I have also got a forearm squeezer. Now I'll go through the basic exercises that I do. I do 2 sets of this range of exercises, starting off with stretching. This is the elbow that I'm having the problem with. Starting off with stretching, with the elbow bent. Pull the fingers back as far as you can to create a stretch in that forearm with the elbow bent at 90 degrees. Hold that for 30 seconds and then push it out until the elbow is straight, and hold that there for 30 seconds. So I do 2 sets of this before I continue any other exercises. So I then do another set with 90 degrees, 30 seconds, the elbow pressed out straight for 30 seconds, Now I'll show you how I do the exercise with the TheraBand. First one that I do, grip the TheraBand in my left arm, take it up to that position so you can see the back of your left hand with the palm of the bottom hand facing you. Grip it tight and rotate. In that position then I roll it 5 times and take it back again. Squeeze it tight. 1, 2, 3, 4, 5. I do 5 sets of that exercise. Then continuing with the TheraBand, I now place my left palm facing me and with my left palm facing me, I now put my opposite hand over the top so that the back of the hand is facing, so I get and grip again tightly, and then I rotate that around so that now I have twisted the TheraBand and both palms are facing me, and then I do the same now. 1, 2, 3, 4, 5. I go back to that position again so that my left palm is facing me, tighten it again. 1, 2, 3, 4, 5. I do 5 sets of that. Last exercise I do with the TheraBand, holding my arm out. My right hand, which is the good arm, stays still, and I rotate it on top with the arm straight out like that. After that, I do the finger stretching exercises. I put my fingers into the holes of the stretcher that I've got, and just spread my fingers out. I do a set of 20 of those, then rest and do another set of 20. An alternative is just to put your fingers into the end of a sock. There you go. Put your fingers into the end of a sock and exactly the same thing. Just stretch them out. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Basically do 20 of those and then rest and do another set of 20. The next exercise I do is just squeezing a tennis ball. Again, you can feel it working the muscles and the tendons along the forearm, squeezing the ball, working those tendons in the forearm. Now I do another 20 of those. Have a rest and do 20 more. As I've said, I also have a forearm squeezer to strengthen those forearm muscles. Just to give you an idea how I use the forearm guard, take it to about a thumb's breadth away from the elbow. You should be able to pick these up for about, this one costs about $12 at the local sports store. So it's got a Velcro strap, it's elasticized so you can pull it tight, and that sits just up from the elbow so that you can bend your elbow still. And as I said, that really just makes it easy when you're doing the exact movement that normally would hurt. This provides some relief. So you can continue to play golf without aggravating the problem too much. The last of the treatment options that I want to show you is the use of a muscle roller, which is a cross-friction rub which is used to break down the micro tears that you have in the tendon already. You have to find somewhere that you can anchor the stick. Here I've just put it up against my thigh, but you can put it onto the back of a chair or the top of a chair. Find anywhere, use your intuition and just then what you do, you push hard against the muscle and roll it up and down, right into the elbow, right where the pain is. Initially, when I started doing this, it produced bruising on the inside, so it certainly caused, it has to be done at a reasonably firm, with firm pressure. The physiotherapists and chiropractors like to use continued deep pressure in a similar fashion to that. Personally, I have found greater success with the cross-friction rub, which the physiotherapists do as well. But to do it yourself and not have to go off to see the physiotherapist daily, that muscle roller helps. The last exercise that you can consider is a strengthening exercise called eccentric contractions. You flex the forearm and slowly release the dumbbell down. Do 3 sets of 15, and you must use a weight that doesn't cause pain. Lastly, just to mention how difficult it is to treat a chronic tendinopathy like this, particularly in older people like myself, where the injuries have probably been present for many years. The micro tears have been building up over a long period. Rest would be advantageous, but if, like myself, you want to carry on exercising, it can take, the exercises continue to aggravate the elbow, and the problem can take many months to resolve. As I said, I use the forearm guard to provide some relief from the pain and reduce the amount of damage that's being done by continuing to use the tendon. I suggest that you try and do these exercises 4 to 5 times per week.